Good afternoon, everyone. You are very welcome to the launch of the second National Men's Health Action Plan. During the event today, we will be sharing documents with you in the chat, which you will be able to download. You will also be able to ask any questions you might have through the Q&A function located at the bottom of your PC or laptop screen. If you are using another digital device, you can also find this feature in the More options on your screen. This webinar is being recorded. Without further ado, I will now hand you over to your host, Lorcan Brennan. Thank you.
Thank you very much, Anne-Marie, and welcome everybody to our special webinar that's marking and celebrating a couple of things: International Men's Day, which is tomorrow, and also for the launch of this, our new Men's Health Action Plan that's going to run from 2024 to 2028. The day itself, International Men's Day, folks, is on tomorrow, of course, the 19th, but already there are people out of the blocks and there's lots of things happening and lots of webinars and discussions that are going on in relation to the reality of men's health internationally and on the island of Ireland, and we're part of that as well. So we're out of the blocks a little bit early, and all of our team are out of the blocks as well. So now today, as I say, we're going to have, this is the third significant policy document in relation to men's health on the island of Ireland, and in a few moments time I'm going to be inviting somebody along to launch this officially for us. But I suppose we've often said in Ireland here on these webinars that men's health is not a greenfield site for us here, and lots has happened across the last number of years that marks men's health in a very significant way. And for that reason, for the next hour or so, we're going to talk with some really interesting and interested people who are part of the pillars of that activity on the island of Ireland, and I know you're going to really enjoy some of the conversations that we're going to have with those people. We're going to have some framing presentations, we'll have one-on-one interviews, we'll have paired interviews, so do stay with us for the next while, because we promise that this is going to be really interesting. You're going to be able to download the documents as well, and other documents as we go along. As I say, we're going to introduce somebody in a moment, but we'll hold that space because first, just to acknowledge that we have a number of partners that make this happen. Webinars don't fall out of the sky, and everybody out there, lots of you I know, are involved in webinars, and there's a lot of work that goes into them. For ourselves, there are key partners involved that are the Men's Health Forum in Ireland, there's the HSE, there's SETU there as well, Noel will be with us later on as well, the Southeast Technological University, and the Men's Development Network. I think also today we're going to have a Q&A bar, and it's just in the context of if anybody has a query or a question, can you please write your question in there, and somebody somewhere, we will come back to you. If we don't know the answer, we'll also follow up with you for sure. So if you want to use the Q&A bar, it is going to be there for you as well. So look, just to begin and get us off here for the start of our webinar, our first guest today is here to perform a fairly vital function, and that's actually to launch the National Men's Health Action Plan for 2024 to 2028. Now, Dr. Philip Crowley is the National Director of Wellbeing, Equality, Climate and Global Health in the HSE. Originally a public health trained general practitioner, he's also adjunct associate professor with the School of Health and Sciences in University College Dublin, and lots else as well. A remarkable career. Philip, we could go through it here for the next 15 minutes, but you're here to do a very important piece of work for us, to welcome and launch, I suppose, the document that I've just shown to everybody, and to highlight the real significance of this document for men's health on the island for the next 4 years. The floor is yours, Philip, and thanks for being with us.
Thank you very much, Lorcan, and thank you very much for including me in today's agenda. A really important day. Obviously, it's Men's Health Day tomorrow, International Men's Health Day tomorrow, but and in a way, in preparing for that, we've decided to launch our kind of landmark policy today, building obviously on the original Men's Health policy in the year 2000. And then in 2017, we had the first Healthy Ireland Men's Health Plan. And it's worthy of note, really, that we were the first country in the world to develop these kinds of work programs and policies. And now we move obviously on to update the 2017 plan with the latest evidence base. And all of this is evidence-based, which I think is really important. And what of men's health? I suppose I've gone through a couple of health issues myself this year, and I suppose it reminds me that maybe we're not the best at looking after our health, and we do remain with a gap in life expectancy and inequalities, I think, around the country in relation to our experiences of health and well-being and our experiences of cardiovascular disease and cancer and screening. We really need to kind of sign up to all of these things to try and look after ourselves better. And part of the health plan, obviously, is to work with men to try and ensure that. Another part, I suppose, of our health and well-being is really important, and you see it really, I think, in the wonderful work of the men's sheds, is this fact that, particularly when we get a little bit older, we can become a little bit isolated. And there's a very significant evidence base to show that social isolation is very bad for our health. It's something that can really significantly harm our health in all kinds of ways, physically as well as psychologically. And I think it's wonderful to see these various initiatives like the men's sheds that seek to kind of break down social isolation and get us kind of being constructive and working together. I think there's a tremendous, I think, emphasis as well in the plan around kind of healthy masculinity and a kind of an endorsement of the White Ribbon campaign and our all of our desire to ensure that all gender-based violence is combated and reduced completely. So obviously in the work that we do with men, what we're doing, we're working with specific groups of men like farmers, older men, people working in construction, and obviously the men's sheds, as I've already kind of mentioned. And none of this work, and indeed none of the work that we do generally in health and well-being, or indeed in an awful lot of the work that I do, we do not do it in isolation. HSE may be a big organization, but it's not one that can achieve progress in isolation or on its own. So we've been working obviously with various departments like the Department of Health and Department of Agriculture. We've been working with health and safety, particularly safety is a big issue, very notably obviously around construction and farming. We're obviously working with our own health and well-being leaders, with the National Office for Suicide Prevention, the National Cancer Control Programme, social inclusion and screening programmes, and very importantly, the Men's Health Network and Forum, which obviously we wouldn't be doing anything without, and we wouldn't be getting anywhere without that kind of partnership. So I think there's obviously a huge amount to be done. I'd like to thank Dr. Noel Richardson, who'll be coming on shortly after me to present the nuts and bolts of the updated work programme. And I really thank him for the evidence and intelligence and expertise he's brought to ensure that we have such a good document to launch today. And while we're going to launch it today, the key is obviously to implement it. So it's one thing to have a very good policy and plan, and it's another thing, obviously, that we need to implement. We need to work together and support each other, challenge each other, and push each other to ensure that this important plan is implemented. And it leaves me with nothing really further to say other than to, with great pleasure, formally launch the Healthy Ireland National Men's Health Plan for 2024 to 2028. And I look forward to the rest of the webinar. It's great to see so many participants on it. It shows the level of interest that there is in this work. And if we work together, we will improve men's health across the island of Ireland. And thank you very much indeed. And thank you, Lorcan.
Thank you very much, Philip, for that lovely introduction and for that overview as well, I suppose, of where we're going in our conversation. And it leads me really well into our next conversation, which is going to be with Peter Baker, because Philip has just mentioned the really important part of implementing this plan. And before you come on there with us, Peter, I suppose just to say a little bit about you, Peter has been the Director of Global Action for Men's Health since 2013. For 12 years until August 2012, Peter was the Chief Executive of the Men's Health Forum in Great Britain. And here, listen to this, folks, until 2020, when he was involved in the campaign director for HPV Action UK, the recognition of his work, Peter received the Royal Society for Public Health 2018 award for outstanding contribution to championing men's health, Peter. And of course, in 2014 and 15, he completed a major review of Ireland's national men's health policy, both the actions plan and also subsequently has been part of the conversations in relation to the Health Action Plan now. Peter, you've been very much part of the conversations internationally and nationally in relation to men's health. And so you have that eye, that critical eye that's looked over where we've come from and where we're going. What is it, can I ask you this to begin with, in the context of Ireland, what is it that's unique about Ireland? Because you've mentioned this before in writing and in conversations you've had and presentations, that's to do with men's health. What's your unique perspective on that? What is it about it?
Well, first of all, Lorcan, thank you very much indeed for your generous introduction, and thank you for inviting me to join you today at the launch of the new action plan. It's a great honour for me to be here with you, so thanks for that. I mean, what's special about Ireland? Well, clearly, as Philip said, you were the first country, Ireland was the first country to develop and launch a national men's health policy, and the significance of that cannot be underestimated. There are still only a handful of countries, about 8 in total, with men's health policies. And some of them, to be honest, haven't been that influential or effective. Ireland is unique in terms of not only the impact that its policy has made, but also that there's been a long-term commitment to this. It wasn't just a policy in 2008 to 13. It was followed up with an action plan and now a second action plan. So this length of commitment is unusual. And is an inspiration to the rest of us elsewhere in the world working on men's health. If we can achieve half of what you've done in other countries, we'll have achieved an awful lot. In terms of what's actually helped bring that about, I think it's a combination of things. I think clearly in Ireland, there's been a group of committed people who have worked together from different backgrounds, different types of organisation, worked together over a long period of time to make this happen. It didn't come from nowhere. There was a long-term commitment amongst a committed group of individuals to work on this and to advocate for it and to implement it. And also, I think there was support from influential people in the Department of Health, the HSE, and government. Without that support, it could never have happened either. So it's a combination of civil society and people in influential positions in the administration. And I think also being part of an international network has helped enormously. I think being able to learn from good practice elsewhere in the world, to be part of a supportive international network of people committed to the development of men's health has also been hugely important. So those are just a few of the things I pick out that have really helped to develop this work in Ireland.
Peter, we're here today because of research and policy and action. How important has that been in the conversation where I think Ireland is recognised internationally that, for example, we had the first policy, but it was also reviewed, and the programmes and the capacity building that grew out of that policy were also reviewed. Is that a significant part of the story of that recognition?
Absolutely. I think the commitment to research and evaluation has been central to the development of the work, and the work that's been done at the National Centre for Men's Health and elsewhere in Ireland has been hugely significant. So, as Philip said before me, this is all based on evidence. It's not just kind of made up. It's not just good ideas, people thinking, oh, well, let's try this, it might work. There's solid evidence behind it, and I think that cannot be underestimated. I think, and as obviously the policies and action plans have developed, they've been evaluated, and the academic research has been built into the programs as well. I think that's hugely important.
In a few moments, we're going to be listening to Noel, and Noel Richardson. He's going to be talking about the new action plan and the recognition within that. There's key pillars in it. One of them being subpopulations of men. Not all men are the same, and there's subpopulations of men that are caught in the cycles of the social determinants. A social determinants approach is really at the heart of the actions going forward. Is that a significant way to go? That I know we have to change behaviours, and it's important how personally we take on those behaviours. But what's your thoughts on that in the context of the new action plan?
Well, I think without recognising the importance of social determinants, this work can't get off the ground. And I think it's absolutely right. The new action plan focuses on equity and intersectionality, looking at the subgroups of men, as you said, that have the worst health outcomes. Clearly, what we've seen in Ireland over the last 15 years or so since the first policy was launched, is a really significant improvement. I mean, Ireland has moved up the league table very significantly in terms of male life expectancy, for example. It's a really dramatic improvement. How much of that is due to the policy alone? we'll never know, but it clearly has had some impact. And I think that, but there are groups that are being left behind. So if you look at, for example, if you look at the data by social class, clearly you see what you probably would expect to see, that lower income groups have done less well. There's clearly a need to focus on traveller men. I know that's been a focus for work for many years in Ireland, but there remains work to be done there. Migrant men as well, similarly. So I think focusing on those groups that we know where the data shows there's still a particular need is the way to go with this. And that's true not only in Ireland, of course, but internationally as well.
Philip spoke about it there a few moments ago, and he talked about the implementation. And I'm just wondering, again, you heard your own CV. You have an eye across Europe, across the world. You've been part of so much that's happened in relation to research and review. In the implementation of this new action plan, what do you feel is your heartfelt? This is the priority. This is really, if you were to give a kind of a lead or an advance to people who are going to be part of the implementation of this, what's up front for you, Peter? What would be up front for you?
Well, a number of things come to mind immediately. I mean, one is to make sure that the plan has high-level support, and my sense is that it does. That there'll have to be people, senior people in the HSE, the Department of Health, politicians who are behind this, who want to actually drive it forward. Because without that high-level support, it's obviously much, much harder. I think the second point is about the implementation group, which is charged with the delivery of this. And, clearly we've seen over the past, 10, 15 years, there's been a very strong group of individuals who have been working on this. But I think there needs to be an openness to bring in other people, to bring in people from different kinds of organisations representing different communities, make sure that the implementation group, the governing group of the project, the policy, the action plan is as diverse as possible. Clearly, there's also an issue of funding. I mean, a huge amount has been achieved with relatively little funds over the years in Ireland, and that's been really significant and quite inspirational. But to see this develop its full potential, this work, there needs to be good. It needs to be well resourced. And the more resourced it is, clearly, the more effective it can be. And the final point I'd mention is the importance of mainstreaming this. So in a way, men's health becomes everybody's responsibility, that it's written into people's job descriptions, into their work programs. So when people at a national or a local level in the health system are, in their annual appraisals, in their weekly supervisions, they're asked, what have you been doing on men's health? They know that this is something that they're accountable for, that they have to report on, because that will really help to drive it forward. That's the way to make it mainstream.
Peter, that's really super way to finish. We ran on time there, but I'm going to bring some of that on to our other conversations. And I know our next input from Noel will be talking a little bit about what you've just said as well. So thank you for joining us. Thank you for being such an ally in the work over the years. And we'll talk to you again. It was really great you were here with us. Thank you very much.
Thank you.
That's Peter Baker with some really good, clear thinking on where we should be going next. And we will be talking to people about that plan in a short while as well. But we've already said that up next is going to be Dr. Noel Richardson. I don't think Noel needs much introduction because he's been so much part of men's health nationally and internationally, and was, of course, the principal author of the National Men's Health Policy, currently director of the National Centre for Men's Health in Carlow at the moment, and does so much on the island. But the screen is going to be yours, Noel, because you're going to actually show us now what is in the action plan and give us an overview of where we're going with it. So the screen is all yours.
Thanks, Lorcan. I'm just going to share a screen here. Great. Well, I'm going to jump straight in. I've got 10 minutes to talk about these four aspects of the new plan. So I'm going to talk about the key landmarks in men's health policy development and implementation to date. What's the case for still having a focus on men's health? Why is men's health still relevant as a health policy population group, if you like? I then talk about the key principles and effective practice that we've established in terms of engaging men and that carry forward to the new action plan. And I'll conclude by just summarising the key thematic areas and tasks. Like the peacock on the front cover of the new action plan, it's a proud day for those of us who have been working in this area now for a number of years. And I'm also reminded that peacocks symbolise new beginnings and masculinity. So on the eve of International Men's Day, this is a really positive note on which to move forward, I think. So this is a really quick kind of summary of what's helped us to gain traction in men's health to date. So Getting Inside Men's Health was the report that was launched at the first conference, National Conference on Men's Health, almost 20 years ago now to the day. But I would like to acknowledge the work, the scoping work and the momentum that was built by Biddy O'Neill, who we'll hear from later in particular, and her colleagues in the Southeast. There were others as well, but I pick out the work of Biddy and her colleagues in getting men's health onto the policy agenda and creating the momentum that led to subsequent policy and action plan development and implementation. There was a few key things that underpin the work to date. The first is that consultation and partnership development have been a key pillar of the work that has been done, and Philip Crowley mentioned this in his introductory remarks. We had an extensive consultation process in developing the first National Men's Health Policy, which was important in its own right, but it was equally important in terms of building the partnerships and the collaborations that would subsequently sustain the actions that we tried to work on in the rollout of the policy. It's also just to note that the policy and the action plans to date have been closely aligned with other policy areas. So the focus has never been about creating a separate field of men's health. Rather, it's been about using the action plan as a kind of a gender mainstreaming toolkit to enhance the effectiveness of health policy more broadly. And finally, I would like to acknowledge Peter's work in conducting the external reviews, which were hugely important in terms of shaping the True Healthy Ireland action plans. And Peter's wisdom and experience and pragmatism, I think, were central to us scaling down the original range of actions that we had in the original men's health policy to a more achievable and quantifiable number in the subsequent action plans. So you might ask, why is policy focus on men's health still relevant today? Well, even though life expectancy has been improving, there's still a 3.5-year gap between male and females. So there's still a bit to go there, I think. Involving improving healthy life expectancy in the context of an aging population. We know that, say, over the next 30 years, the proportion of the population aged 80 will treble. So it's really important that we have we keep more people healthier for longer. Otherwise, our health services, which are already starting to feel the pressure, will be overstretched if with an aging population. We need to target interventions to those male population groups most in need. The gap in life expectancy between those males in the lowest deprivation index compared to the highest deprivation index is 5 years. It's greater than male-female life expectancy. So while we tend to think of men's health in binary terms as distinct from women's health, it's actually more important to be focused on within group and within subpopulations and under the category of men's health, and to target those interventions and programs to those men most in need. We also need to focus on tackling the lead causes of male deaths by engaging men in lifestyle and health behaviour change. So 4 out of 5 deaths in Ireland are caused by non-communicable diseases or the chronic diseases like cancers and cardiorespiratory illnesses. So we know that lifestyles have a crucial role to play in that. And we know that men, for example, are more likely to smoke. They're much more likely to binge drink, much more likely to be overweight and obese. So we need programs like Sheds for Life, like Farmers of Hearts, like Men in the Move, that provide a kind of gender lens to engaging men and engaging the so-called hard-to-reach groups of men and lifestyle and health behavior change, mortality from these chronic conditions. We also need to maintain a gender spotlight on men's health. So, for example, in the area of mental health, socialized expectations of stoicism and self-reliance may discourage men from seeking help for mental health issues. So again, the likes of On Firm Ground and Corda have a key role to play in addressing these challenges by engaging men in the gender-sensitive, gender-specific way. And we know as well that by engaging in men's health, it has ripple effects on women and children's health. And by men caring for and nurturing their own health, they learn to care for and nurture others. And put simply, it's the right thing to do. So the action plan has huge potential to address these SDGs, health and well-being, gender equality, and reducing inequalities. So it's good for everyone that there's a focus on men's health. And this is from the WHO, and I think because we've been involved in this area now for a number of years, we've managed to work from what essentially was a gender unequal or gender blind context where services were provided without any regard to the impact of gender and wider cultural norms that shape health behaviours. So the challenge is to move towards gender transformative approaches. And if I could just highlight the Corda project as an example of that. So we're trying to develop training programs that engage health connectors in the workplace and building sites, and general awareness training that targets men who work in building sites. But a key aspect is to try and get the industry on board to help with that process. So that means changing cultural norms, challenging stigma, and so on. So that's the mecca we're all striving to reach, I guess. We've learned a lot along the way, and we started out with a number of principles in the original National Men's Health Policy that have since been kind of honed and fine-tuned. And these are the ones we've highlighted in the new action plan. And I won't have time to go through all these, but these guide us, provide a kind of a framework on which to work, and will stand us in good stead in the implementation of the new action plan, I think. And engaging men in health, what does effective practice look like? These are important about engaging men. And it's really important to say there's no one size fits all. And we need to move beyond stereotypes about masculinity and understand gender as intersectional. So it's not just a gendered approach. So gender intersects with social class, education, ethnicity, and so on. Peter mentioned travelers. We need an intersection approach to developing programs for these at-risk and hard-to-reach groups of men. And the two key questions we need to ask in this regard are, what barriers prevent men from accessing services and supports? And how can we attract men to participate and sustain their involvement over time? And again, this evidence of best practice is crucial in that regard. So just to finally then, just to talk about the key thematic areas that are in the policy. So theme one is addressing inequalities and building health equity between different population groups of men by focusing on the priority programs of Healthy Ireland, including screening programs and suicide prevention. So theme one is applying a gender lens to health promotion and prevention and covers a range of male population groups. It addresses different topics in different settings, and it includes tasks related to physical, mental, and sexual health across the life course with different methodologies to engage different groups. Theme two is about building capacity for those who work with boys and men, and engage is the key pillar of this work. And we've seen engage broaden out to work, say, on firm ground with the Department of Agriculture, and that sets a really good template on which to expand this work with the new action plan. Theme three is about research and about continuing to contribute to the evidence base, and to make sure that our work is underpinned by a strong evidence base. And much of the research that we've carried out has been in partnership with the HSE and NGOs, and has resulted in kind of tangible outputs and toolkits to inform practice. And finally, the fourth theme is about appropriate governance structures to oversee the implementation of the new action plan. And Peter talked about the importance of governance in terms of success in this regard. So that's really welcome. So just to end, and before I hand you back to Lorcan, I noted earlier that peacocks symbolise masculinity. But a related and interesting fact from Wikipedia, of course, is that peahens judge their partners by their appearance, visual display of features, dancing and other vocalizations. So Lorcan, on the eve of International Men's Day, keep an eye out for the men of Wexford engaging in these, what can only be described as mating rituals, I think. Thank you very much.
Thank you so much, Noel, and thank you for framing that so well in relation to what we know now is in there in our action plan and shared with us so clearly. We're going to bring some of those themes also along into conversations we're going to have with two key people in the not so distant future. So thank you so much. Look, just after that, what Noel has just said to us and talking back across some of the things that have happened over the years, we have, just to draw breath for a few moments, we're going to show you a very short video, a little collage that I think would be nice to watch in relation to some of those interventions, I suppose, that Noel talked about, programs that are happening across the country over the last number of years. Have a look. There you go, folks. Much delivered, but more to deliver, and the action plan will help us to do that with key partners over the next number of years, 4 years and beyond. And after Noel, I suppose, it's lovely now we have the opportunity to step, I suppose, from the policy to the personal, because the next interview is with somebody that maybe some of you might know from before. He's a man called John Wall, and John is an advocate in relation to men's health on the island of Ireland. And I suppose the new action plan has a very strong emphasis on advocacy and on men as advocates as well for health and well-being, and carrying the message of health to one another and to other people as well along the way. Now, John is a native of Clare, and he was living his life, happily married, all going well, and then he discovered through diagnosis that he had stage 4 cancer. And that's fairly shocking news as a young man to discover something. But John, as well as getting looked after in relation to his cancer, he'd also heard about the Mary Keating Foundation and the Stand Up for Your Prostate. And out of that calling, he became an advocate for men's health and is still doing so now. John is not with us live today, but he did put himself aside in a very busy week to have a chat with me very recently. And we're going to show just that interview now, and we ask you to sit back and listen to this, because this is around the real sign of an advocate in action, and we'll come back after that. John Wall, it's lovely to see you again. We did speak some time ago, and just to have you back here on the screen with me, with the support of our good colleague Collie Fowler in the background there, is a real treat. Delighted to have a chance to talk to you, especially about a really important document that's just going to be fresh off the presses as it is today. And that's in relation to the National Men's Health Action Plan for Healthy Ireland, which goes from 2024 to 2028. John, people will know you maybe from before, and I've already will have given an introduction for you because everybody will know this is not a live interview. You've been good enough to give us this interview before you go out of the country, but we did want to talk to you in a very special way because you're an advocate for men's health nationally. And it comes from a diagnosis that you got back in 2017, which was a very challenging diagnosis for a young man in relation to cancer. And can you just maybe say a little bit about that before we go anywhere else in the interview, around getting that diagnosis, your life's going perfectly, you're a young man, young family, and suddenly, tell us a little bit about that for a moment, please.
Collie, thanks for the opportunity. Yeah, sure. Back in 2017, I was diagnosed with stage 4 prostate cancer. It was a bit of a shock to the system. I suppose it went from 0 to 60 in a very, very short few days. And I suppose ultimately what happened was I received a barrage of treatment at home and abroad. The standards, you have the chemotherapy, surgery in Belgium, radiotherapy in Galway, and went on hormone treatment then for a number of years afterwards. And fortunately, things worked for me because now I'm at a point where I consider myself to be living a relatively normal, healthy life that was completely unforeseen a few short years ago. And a lot of that is down to conversations like this, I suppose the openness and learning to talk about my health, my body, my mind, my life. And indeed, I suppose that of those around me as well.
And John, you know, that's what I'm really fascinated by. And the last time we talked about it, it stayed with me afterwards as well. You know, when you get the news, maybe for myself, other people, we might just kind of go recline, go back, stay in. You didn't, you responded. And since the diagnosis and through the diagnosis and the recovery, you have been very much an advocate for men's health. Where did that response come from? Do you mind me asking you? Why was that so for you particularly?
I was inspired by others. At the time, I guess it was women that were talking about their health. It was women talking about their bodies. That's certainly what I saw. But they inspired me. People like Lorcan Brennan, people like Vicky Phelan, they inspired me, I suppose, to get up and deal with it, to do what I can to help others, to make sure that what happened to me, I was a combination of doesn't help or doesn't happen to others, and also if it does, that my lived experience can help those. And it's also very therapeutic for me because it means that the diagnosis and what I went through counts in my mind for something, and it's not just something I went through, it's something that I've also learned from, and made me the person that I am today, and to live the life that I'm able to.
In the new action plan, there is an emphasis on many different approaches that we take and know that work in evidence in relation to men's health. One of them is a relational approach, and you're a very personable kind of guy, you know, from the few times we've talked. How important was that for you then? You're saying that it seems to be at the core of your recovery, that the relational aspect of getting out and talking and becoming an advocate was hugely important for you in relation to that.
Absolutely vital. The ability to learn from others, to open up to others. Bear in mind that after my diagnosis, that period of not just my life, but the world shut down for a lot of us, in that normality became a thing of the past, and we entered into a number of years where isolation was something that we unfortunately had to live with. And those of us that were compromised, those of us that were ill, it was hard to see a way out. So when the new normal resumed, the ability to talk, it encouraged, I think, a lot of us to open up to each other, to talk about things, to normalize conversations, to talk about things, especially amongst men, that we didn't talk about before, or if we did, it was after a few jars, it was with a bit of Dutch courage. You drop, but now we talk about our bodies and our feelings as we should. It's a normal conversation to have where we learn from each other. And it's really important to encourage each other to talk, and not only amongst ourselves, but there's a lot of professional help out there for us, mental, physical, both. It's just a matter of knowing where to go, knowing who to talk to, and the courage to do so. And if you haven't, well, that's why we have family, that's why we have friends in our lives. And I suppose one thing that I would have been in the past was notoriously private, despite outward appearance, inwards, very, very private. Didn't delve too deep into how I felt. Certainly didn't talk about it. But now that I have done and continue to do so, I can only hope that others benefit in the same way that I do, even though, there are times I might look and sound okay and all the rest of it, but I have bad days too. I have some, difficult periods in my life. But I have no problem saying that I put the law of Suez, and if I need help, I go get it. It's very simple. I deal with it. It's what we need to do. We only have one life, so we gotta make the most of it and protect it.
The last time we talked, John, I think you said something about, for some men, the fear of knowing. If you won't go to the doctor because maybe you do feel there might be something wrong and you're not sure how you might cope with that, Again, in the context of the action plan, that we're hoping that exactly what you're saying, that men might be able to, find the next step into the place where they would find that safety to be able to talk or get to that service. Again, what would you say to that man who maybe is that person with the fear of knowing about something that won't take that step? What is your word for him in a day like today?
Consider the fear of not dealing with it, or consider the consequences of not dealing with something. Consider the consequences of ignoring something, not just for yourself, but to your loved ones. I got lucky, but I analogize it to a car service, that we look after our cars meticulously, and there may be nothing wrong with the car, it may be going fine. And if it's due a service, we bring it to the garage. But our bodies, on the other hand, we wait for something to go wrong. And I think what we need to start doing is, you get past a certain age, or if you have a family history, or if you just feel the need to do so, get a health check. They're relatively inexpensive. And it is the difference in some cases between life and death, between struggling with various aspects of life or not. But the important point being that if you do feel the need to talk, there's always someone out there to talk to listen. And so one thing I've learned by discussing things in somewhat of a public manner over the years, people don't always engage with you, but they listen, they hear what you're saying, and they take that on board. And that may encourage others to go deal with the issues that they're dealing with in their lives as well. There's been a dramatic sea change over the last number of years, I have found, in the conversations, the normal conversations that we're having, along with the football and the weather and the politics and whatever else is going on out there. We're now talking about us, about ourselves, and how we feel, and the difficulties that we're experiencing. And I think that's really, really important, because for me, when others talk to me about their experience, I learn from them. That helps me. So I can only assume that by talking and having conversations like this, that helps others.
Well, look, thank you so much for talking to us now and for giving your time. I know you're very busy and you have to get away as well. So look, thank you so much for all your work and your volunteering on behalf of men, and the call to advocacy that's there for all of us into the years ahead. And hopefully we'll be meeting you out there along the way as well. So do go well and stay well, John. Thank you very much.
Lorcan, thank you very, very much.
Wow, thanks to John for his incredible work, incredible story, sharing his story. And I know that's been a huge resource for other men that he's talked to and has been with as well along the last number of years. So it's a lovely introduction, actually, because to go from the personal again and back into the systemic and back into, I suppose, the next steps in relation to the action plan. And I have with me coming on screen here now two people who've been very much part of the story of men's health on the island of Ireland. Biddy O'Neill is there, and Biddy is the National Project Leader in Health and Wellbeing in the Department of Health. And as Noel has already said, she's been a leader in men's health and has worked in health promotion for over 25 years at both strategic and operational level. Her current role is strategic responsibility for healthy workplaces, healthy campuses, healthy clubs, and mental health promotion. And then we have Fergal on there as well, Fergal Fox. And most people who've been on our webinars will know Fergal, and also from the webinars, from the podcasts, and from lots else as well. Fergal, and you're the head stakeholder engagement and communications, HSE Health and Wellbeing as well. Can I start here, folks, because we've had a lot of information even to date. I'm going to show you that, Biddy. Does this ring a bell? We're going back over 20 years, folks, getting inside men's health. The document that started at a really, probably an international conversation. Biddy, can I start with you? When you look back on that, and we launched that, the first piece of research, bringing it all together, what stands out from this that led us to where we are today?
Thanks, Lorcan, and congratulations on getting the new action plan over the line and launched in the HSE. So that's a really good milestone. So I suppose in terms of looking back, I think listening to Peter, he really kind of summed it up, I suppose, in terms of initially that it was in a national policy, because that gave us, I suppose, the opening to really move on this. Because if something is not identified in national policy, then it's very difficult to get it on the agenda. So that was the starting point. And I suppose we were very aware at the outset we didn't have any research. We didn't have any baseline to go on in terms of men's health. And I think that piece of research was really so important in terms of setting the scene for the policy. And it really gave the context for it and really gave the direction. So, and again, we were so fortunate to have Noel and Paula Carl at the time, who were huge academic experience, and the research was so robust and really comprehensive. So we were very fortunate, I suppose, that there was a number of things that went well for us. And then, as Peter mentioned also, there was other key players around the country who were interested, and we literally have all stayed together, stuck together, worked together, and really brought the best of everything into where we're at now. So it's really a wonderful journey, not without lots of hiccups and ups and downs, but I think there's some really good work happening in this space in 2024.
Okay. Fergal, Philip, at the very beginning, when we launched in here this morning, he highlighted as well, like HSE is a big organisation, but it's, collaboration is hugely important in the delivery. You surely agree with that in the context of statutory support, community-based organisations.
100%. Some of the things that Philip called out, and I want to echo, like our internal partners of having the likes of the National Screening Service, the National Cancer Control Programme, National Office for Suicide Prevention, National Office for Social Inclusion and the HSE, and our own programmes nationally in health and wellbeing, the likes of tobacco, mental health and wellbeing, alcohol, seeing the intersection of men's health across all these topic areas and for different age groups. Never mind when you come out to the operational system of health promotion and improvement working out there, and then you're talking about a myriad of Section 39 agencies or community actors that aren't even funded by the HSE, but see themselves as having a health and social care responsibility. You're talking about the personal and the professional there. I had an interesting experience recently with an under-14 team that I coach, and we were after losing a final, and this little Syrian lad was trying to keep it together. He was trying to hold his emotions. You could see him welling up. And there was a little traveller lad beside him. Both of them had played on the same team, but the traveller lad turned to the Syrian lad and said, "You're not going to cry, are you?" And I thought, I was trying to protect the lad that was kind of just on the edge of tears, but like it was, he was after losing a game. And I thought, that's the men's health seeps into so many things. And you look at an organization like the GA, and they're engaging men and boys, and the whole healthy club initiative that we've highlighted in the previous plan. But like there's just so many actors, I see it, and so many spaces for men's health. And I think one of the messages that I'd like to highlight today is that there's space for everybody to support men's health. And a lot of people are supporting men's health, even by, encouraging sports participation, at any level, or any participation at any level of young boys. But that was just a little moment that I had last week that I thought, I don't see myself as an operational practitioner anymore in men's health. I used to work with men hands-on, and I don't really do that anymore. But I just had that little moment, and I thought, it's in these nuggets that you think, oh, well, it's challenging, but it's positive.
And Biddy, when you think back on what Noel spoke about there a few moments ago, he talked right at the heart of this new action plan is what we call gender transformative approaches. And I suppose those conversations, and we had our last speaker on who was talking about as well, he's saying in his lifetime it's changing, that there's conversations now being had that weren't being had before. That's really, really good. And to be able to build on that through an action plan that's significant and specific in programs and resources, that's really significant, isn't it?
Yeah, absolutely. But I suppose, as Fergal said, we need to be coming at this from so many angles. And you would hope that, with the social personal health education in schools, that is making boys more aware of their emotions and normalizing it and encouraging them to seek help and seek support if they're in trouble. So it's trying to normalize all of that, I suppose, break down those barriers that were probably entrenched in people, many generations ago. And are still there as the little example Fergal has given. But I suppose the more messages that we give, or the more areas of influence to try and change that, and having advocates like John is quite profound in terms of him having moved through the whole process and opening up and sharing that. I think that is a huge benefit on other men as well, to begin to grasp this. And I do think there's a lot of research as well around fathers changing their role, becoming more involved. So I do think there's good hope for the future, but I think there's still quite a lot of bit of work to be done in terms of mental and addressing the disparities.
Peter Baker talked about the idea of this cross-department approach. For example, on Firm Ground, is one of those initiatives. Department of Health, Department of Agriculture, HSE, and the different organisations, MHFI, involved in it. Biddy, how important is that in relation to your own role in your Department of Health there?
Yeah, so I think it's critical, and I suppose the whole process of Healthy Ireland is that it's a whole of government approach, and that if we are to address health and well-being, that we need other players involved. And the piece of work around on Firm Ground is a lovely example, and Fergal and I have often talked about this. That it could take years to get a piece of work like that going, get another government department to take it on. They're now funding it. They're seeing the health and well-being of their farmers, the people who serve the farmers, all the workers, as being important. And that's a huge milestone. They're owning that. And I suppose that is a really good example of where good engagement across government can have really positive results. And again, it's a good example of Healthy Ireland in action when you get that kind of response. But it's the cross-government piece is challenging, and it can be very much down to individuals. And we had, we met the right people in agriculture. They, I think, actually approached us initially, which was really positive. So it's about building those relationships as well, and getting change embedded in their policies and strategies, and getting them to own, I suppose, the work like on Firm Ground.
Fergal, isn't it a significant move, building on what Biddy has said as well? Even, for example, now we're talking gender equality within the document, and we're talking about white ribbon, and we're talking about, so the recognition of, even in this gender transformative approaches, that seems to broaden out health, but in a very specific way around changing behaviours and changing attitudes. Isn't that really significant to have that mentioned within a document?
It is. We have a lot of work to do now. We've signed up to doing a lot of work. One of the actions is focused on healthy masculinities. And that's a term can mean lots of things for people. For us, we see it in terms of your lifestyle behavior, engagement with health and well-being, and your support for gender equality. And I guess that action is born out of the feeling from a lot of the stakeholders that there's a need to be more explicit on masculinities as a positive thing rather than a negative thing. And that will require, you know, cross-agency support as well. I'd like to echo what Biddy said in relation to the Department of Agriculture, you know, and that the Department of Agriculture invited me to speak tomorrow to a group of their staff, and they developed recently their own health and well-being strategy for their own staff, you know, so they have shown great leadership there. And I recently recorded a podcast with around farmer well-being with John McNamara from Teagasc and Noel Colgan from Mental Health Ireland. Hopefully we'll have that out in a couple of weeks, but like listening to their depth of engagement around farmer well-being, you know, you're talking about, you know, the Mental Health Ireland perspective, the Teagasc perspective, and like, you know, the work done over the last 15 years. And some of that work was seeded in the policy, you know, like it's not a departure in recent years, but what we have seen is, as Biddy highlighted, real funding, not just talk, you know, like, and it's developed solid programs. I know On Firm Ground was explained a bit more in depth in some of our previous webinars, and it's been referenced today. All the people on today may not know that much about it, but training up people that are working in the agricultural industry to be able to have health and wellbeing conversations with farmers is, in a small way, revolutionary around, you know, I suppose, just getting those health and wellbeing supportive conversations and signposting conversations out to every nook and cranny that we think they're needed.
Very good. Folks, we're running on time, unfortunately, but I'm going to ask Biddy this, if that's okay, Fergal. I won't get a chance to come back to you. Biddy, it's a big document, and big documents, you know, when you look at them, priorities, and people have talked about priority. What's your heart priority for this? Your head and your heart priority now that we hit the tarmac with it. There's people named behind actions and organisations, and so what's your sense of where we go now?
Well, I think we're in a good place insofar as that there was funding allocated for budget 24 for a national lead in the HSE, which I think is a really positive step. Something I think we've been advocating for a number of years, because there's so much work to coordinate. So I suppose for me, there's like all the actions in there relevant in terms of health inequalities and all building capacity, but I think there's a huge piece of work around coordination to begin to identify and map out all the different pieces of work that are happening in relation to men's health, because I think there is a huge breadth of work happening. So for someone to be able to pull all that together and then align it with the current action plan, I think that's a big step. And that's not aside all the other actions that are in there, they're all relevant.
Well, good folks, thank you very much. I would love to have had another 15 minutes at least just to chat through some of the more specifics in the document. But well done. It's an important day that we're launching this document. And as Biddy and Fergal have said, there's lots to do. I would say to people, as we are running on time, download, look through, see where you belong in it as an organisation, as individuals. And as I say, it is a document about men and for men as well. It's not just a policy in relation to service provision. And that's a really important part of where we're going as well. So we're going to show you video, folks. Just stay with us for another few moments, if you will. And we're going to show you a little video to remind us why we actually are here today. It's only short, and then we'll bring you home safely. Yes, the 6 pillars of International Men's Day, and changing the world and making a difference in the world is a really important part of that. And hopefully what we've been about here for the hour today has been in some way a part of that as well. And hopefully this document in a systemic way through all of us building our capacities to engage with men will make that difference as well. Folks, before we go, the very last thing, we had on our really good advocate, John Wall, talking to us about men and for men. We've been talking a lot about policy here today, but it's also for the men of Ireland tomorrow, just to call, I suppose, before we go off the year here today. Just a call to attention, especially about minding ourselves and minding our own health and well-being. And there's a giveaway for everybody in the audience, because we do have something that's really important in relation to that, and that's the Action Man booklet that we've launched here before and talked about. And we're going to put that up as a PDF for everybody out there. And what I'm saying, and I often say this when I'm working in the rooms of Ireland anyway, is that to all men everywhere, you know, sometimes services are not just for other people, that we are the other people, and that those services are for us. And in my own life, I wouldn't be here on the screen with you myself today, only for the significance of some of those services that have been a huge support in my life, and the people, either in the context of medically or psychologically or supportively. Really, really important. So if there was something we're to do for ourselves on the eve of International Men's Day, for all of us, that we would have that conversation with ourselves to see, is there something that we need to do in relation to minding our health and our well-being? That would be a really, really important thing, to get the answer to that and to incrementally act in our own favour, for our own goodness, like our good friend John from Clare would tell us to do. So look, thanks to everybody for being here with us today. Thanks to Biddy and Fergal and John and Peter and Philip and Noel, and to all the people behind us that make this happen as well. We wish you a really good International Men's Day. And as I say, this is only a beginning. This document now gives us a systemic approach to work together to build on new things into the future. So look, until the next time, let's mind each other, let's mind ourselves, and let's go well. And thanks to our friends in IMS who mind us so well here electronically, and keep us right in the virtual world. Go well, everybody. Thank you very much.